Everybody, let me just greet you all as warmly and friendly as I possibly can. You know my name. I'm a public health doctor and I've worked on pandemics, outbreaks of disease, as well as on a number of other challenges like poor nutrition or lack of food for the last 17 years as an international civil servant. Before that, I had jobs in different governments. And my objective during the next period, it'll be about 15 minutes, is to just make sure that everybody here has the same basic understanding of this pandemic, so that then helps you as you go through your program of looking at banking supervision in unprecedented times. Now, because I'm going to talk to you in a very straight medical way, some of what I say will be quite rough, and I hope you will accept that I'm talking to you as a public health person and I'm giving you what I know to be the truth. I'm not going to sugarcoat it. And of course, if you want to comment or critique, please do so in the chat line. As Babak said, what I have to keep saying to everybody is this is a really dangerous virus. It's very easy to underestimate it. And you can often hear people saying things like, it's just like a flu, or it's a mild disease. I'm telling you, it's not a mild disease. It's a rather unkind and potentially dangerous virus that has already, we believe, killed 500,000 people in the last 6 months and is set to kill an awful lot more in the coming 6 months to 1 year. Because this virus is not going to go away anytime soon. It's a coronavirus. We've never had a pandemic before caused by a coronavirus. The coronaviruses tend to be really persistent and hard to control. And that means that we're actually learning while doing. If this was a flu virus, then we'd have some pretty good ideas about how it's going to behave. We've had lots of flu pandemics over the years. But because this is a coronavirus pandemic, because it's a brand new coronavirus, I'm asking everybody, take it seriously, don't underestimate it. I'm also saying that I believe this virus is going to be around for the foreseeable future. You see, because it's a stable virus, it's not just going to disappear. And unfortunately, we're not going to reach a point where everybody is suddenly immune to the virus, because it actually has very local outbreaks that it starts wherever there's a person with the disease. And then thirdly, it's going to take a long time for a vaccine to become available and to be given to everybody who needs it. Probably it'll be 2.5 years, absolute minimum, before everybody is able to access the vaccine. So we need to learn to live with this dangerous enemy for the next 2.5 years. And I'm going to tell you some of the things we've learned about how to do this. To get ahead of the virus, we have to keep it at bay. We have to defend societies against it. To defend a society against this virus, it's necessary for people to behave in ways that make it hard for the virus to be transmitted. And it's necessary to have public health services that work in support of people's efforts to keep themselves healthy. So what do I mean about people behaving in a particular way? Answer, maintain physical distance from other people. Wear face protection, ideally whenever you're in connection with other people. Try to be in well-ventilated outdoor settings. Avoid very confined, poorly ventilated areas. Practice personal hygiene regularly, hand washing, cough etiquette, and so on. Protect people who are vulnerable. That's the people who are older or who've got other diseases, because they can get very badly affected and may end up dying. So those are the basic rules: physical distancing, face protection, hygiene, and then protecting people from being infected if they're at high risk. Now, these behaviors need to be practiced everywhere. They need to be in every single part of our world. It'll take humanity some weeks to come to terms with the changes that are needed. Some people will not be able to make changes, particularly poor people or powerless people who will be forced to go on working even when it's dangerous. For example, people in certain kinds of food factories or in certain other manufacturing processes, people working in security, in shops, at the tills in supermarkets, people providing residential care for old people, people on ships. All these are settings where the virus is most likely to be transmitted. So there's still some work to be done to reduce the risk of transmission in high-risk settings. And that's going to be relevant to you, because employers are going to be looking for money to enable them to adapt workplaces so they're less likely to become places where the disease is spread. It's quite likely there's also going to be requirements for changes in the living conditions of people, where people live in very close confinement with poor ventilation, like in prisons or in ships or in migrant worker camps. Then there needs to be some modification, because unless there's modification, conditions will not improve and COVID will continue to be spread. So to get on top of this disease, people need to change their behavior, and they need help to change their behavior. The second thing is that public health services need to be strong. And that means having the ability to detect people with the disease, to isolate them as soon as they've been found, to find their contacts and to isolate their contacts, and to suppress outbreaks if they do unfortunately build up. But to do that, you have to be able to know where the disease is. You have to be able to organize to isolate people, and you have to be able to find the contacts of people. You don't hear about that so much, but it's what we call the basic public health services that have to be put in place to deal with any infectious disease. And what I'm saying to governments is, put these basic services in place, then you're able to get on top of the disease. Ignore these basic services, and then the disease just builds up and you get new outbreaks, like what's happening at the moment in Leicester in the UK, in northern Germany, in parts of Portugal, and in parts of Spain and Italy. You get the new outbreaks coming, you've got to stop them. And that is the way you keep society going. If you don't stop them and the outbreaks build up, then you get into a situation like we had in New York, or like what's happening in parts of Peru, or Ecuador, or Sao Paulo state in Brazil, or in Santiago in Chile. You know, as soon as you get these kinds of build-ups, then that becomes a really big challenge to handle. So have the capacity, first of all, for people everywhere to reduce transmission, and secondly, to make sure that you can dismantle outbreaks and suppress them very, very quickly as soon as they start to build up. So moving towards the end now, what do I anticipate is going to be the next few months? First of all, we will all be learning to live with this virus. We will all be needing to shift our behavior. We will all be needing to make sure that public health services work. And to get all those steps into place, we will have to work within governments and between governments with a degree of cooperation like we have never seen before. Because this virus is going to go on. It's not just going to suddenly stop. And it's going to go on into the end of 2020 and into 2021. And unless there is some kind of agreement between countries on how we're going to work together to deal with this virus, it'll be very hard for international travel and communications to open up. So we have to have really strong cooperation. Right now, that's difficult. There are certain political leaders who think that life is better served if they are constantly fighting each other. We see within countries that fighting between leaders creates a very easy situation for the virus to move around with. And we've seen that fighting between countries is really damaging. So we really do have to have strong agreements between countries on how to deal with this. Strong agreements on how to best treat people who've got the disease, to avoid hospitals getting overloaded. How to best help people who have to adapt their lives because part of the control measures against the disease. How to do international travel and tourism. How to do international movements of laborers. And how to do international movement of goods. All this requires working together between countries that is seamless and that is without constant attacks by individual nations. I hope that all of you working in banking and finance will do everything you can to encourage ministers of finance everywhere for the sake of their people to work together. If they don't work together, then we get bust-ups. And if we have bust-ups, the people who miss out at the end are people living in poor countries and in poor communities. So for the sake, particularly of poor people everywhere, we have to work for better cooperation. We also need cooperation on new science, on the new diagnostics to be able to test people who've got the disease. We need cooperation very much on sharing of information between scientists so that they can actually work together on the best way to overcome the problems caused by COVID. And we need sharing of information between businesses who are trying to establish worldwide systems for ensuring that their staff are properly protected, as well as businesses that are trying to work across national borders. Just a couple of words as I close on the work that I'm going to be doing in the coming months. I'm going to continue to focus on what happens in the countries that have shown they can get on top of their COVID by reducing economic activity, reducing movement, and watching their case numbers come down. These countries, including United Kingdom, France, Spain, Italy, Switzerland, Germany, Netherlands, and the Nordic countries, they are now anticipating new resurgences of disease as movement increases, whilst at the same time the countries try to put in place their public health defences. So to these governments, I'm saying, be ready for more outbreaks to come, but be well able to get on top of them straight away. In the United States, it's been a bit different. There we didn't have the country as a whole taking the virus very seriously. We didn't have a single strategy. We've had very varied strategies in the United States. So the current situation in the US is one of a country that doesn't quite know whether it's near the end of its early outbreaks or whether it's still continuing with early outbreaks moving across to different parts of the country. For the United States, our line is simple: take this virus seriously. Everybody needs to look out. There are signs that the level of infection in the United States is rapidly increasing and that more and more people all over the country are at risk. It's in a very, very acute situation, the US. For Latin America, Southern Africa, South Asia, Indonesia, we're saying, please continue to try to make sure this virus does not become deeply rooted in your countries. Please continue to focus on the places where it is being most transmitted. Please do everything you can to make certain that poor people and poor communities are properly protected. Within developing countries, health services are not strong and they're easily overwhelmed. Supplies are short. So let's do everything we can to preserve basic services in poor countries, because the pandemic is spreading really rapidly in poor countries. And in the next 3 to 6 months, we expect it to become widespread in every poorer country in the world. And we don't expect this pandemic somehow to have disappeared by early 2021. Instead, we expect that different countries everywhere will be rapidly putting in place the measures they need to keep on top of the pandemic. It's still some way to go before we can look and say, aha, we're through it now. We are going to be living with this virus for many months and I fear years to come. Thank you.